All right. Good evening, everyone. Welcome to the Poly Podcast. So tonight I was thinking like I want to do like a sexy voice, like this is a Poly Pimp podcast.
I love it. I
Do
love
it.
I don't know how to do that. That's why I
That
said
is
I would
so
do this.
funny.
Every
You had this
every
whole great
podcast, every
idea.
listen to right.
Now
It
you got to
starts with
execute it.
sexy voice, like this is the Poly Pimp podcast.
I love it. It's perfect.
Yes. Even though we're just all nerds here.
It's
You know.
all good.
Right. I
Good
tell
evening,
people I
ladies and gentlemen. Welcome to the Poly Pimp
I
you
love
did
it.
it right.
podcast.
You did it
You
great.
did it right,
I
Sky.
did it? Oh, okay.
Yes. Again, my name is Me Too. We have Sky, and tonight we have an amazing guest with us. Her name is Masanya.
Hey,
And
Mhm.
everyone.
I said it right.
Thank you.
Masanya. I love that name.
Thank you so much. My
Yeah.
mom
Yeah.
gave it to me.
Because
It's
she was
stuck.
like, I'm curious to know to see how you guys are gonna say my name. So
Yeah, I was like, I wonder.
thinking.
You guys were close. Everyone says Masonia, and I just laugh every time.
Oh, it's Masanya?
Masanya.
Okay.
Yep.
Yep, that works. That's beautiful.
Thank you.
And
Thank
my
you.
ears are feeling kind of warm. I did turn on my little space heater because my room is like really cold. I feel like I probably have to turn it off.
Right, because the
Premenopause.
conversation heat up.
Because your ears are cold. Your ears are warm.
I
Usually
know
your ears are cold.
they
Okay.
are really warm right now, so I'm like, maybe I should turn that thing off. But yes, welcome everybody. Welcome. We are here on a Tuesday instead of a
Yes.
Wednesday because we got a life too, and we wanted to put an extra episode in. Unfortunately, next week, as promised, we will not be here.
As promised.
Well, well, we promised, but now we're taking it back. That's why we are here tonight. So because somebody's going somewhere. I don't know who that might be.
I have no idea.
I'm not gonna tell anybody's business. It's not me. It's not Masanya. So I don't know who it might be. So,
So wild.
so we are here tonight on a Tuesday because tomorrow I have a date. I have to go somewhere, and yes, I'm going to a concert actually tomorrow night.
That's exactly. I would not miss a concert
No.
for the podcast.
But to be fair, though, we weren't supposed to have the podcast tomorrow. It was going to
Right.
be next week. So I was in the clear, but it just so happened like that, unfortunately. And this lady's just so amazing, Teresa Griffin. She's from Chicago, and oh my God, I saw her on a cruise last year. And I just fell in love. I was just kind of like mesmerized when she was singing, and she sang a couple of my favorite songs too. I was like, I just love her so much. So when I knew she was coming to Atlanta, I was like, there's no way I'm gonna miss that.
Yeah, I love that. That's why that's the benefit of living in a big city. All the artists come here.
Yes.
Mecca.
Yeah. Hey, Sean. Thank you for tuning in, and remember to participate if you want to come on screen, guys. We are here. Let's post the link in case somebody wants to jump in and talk with us on camera, off camera, just your voice, your face, all of it. We accept it all, or you can post something in the comments. We are here for it, and we would love to get your feedback.
Yes, we would. We like the folks who are a little bit adventurous.
Yes,
Right.
we absolutely love that. So, Masanya, tell us a little bit about you. Were you listening, watching, participating from before we get started on the subject?
Absolutely. So I am a Brooklyn girl from Brooklyn, New York.
Yes, New York in the house.
New York in the house.
Bring it, bring it, bring it.
And I am an infectious disease nurse manager. I manage a clinic in Jamaica, Queens. We take care of HIV, AIDS, chlamydia, gonorrhea, herpes, hepatitis B, you name it, syphilis. I take care of it all with an amazing team. And I think that it's so important to discuss sexual health because we're all having sex. You know
Yes.
what I mean? Some of us
Ideally,
are having,
ideally,
ideally, right? Even if we're having it by
Ideally.
ourselves, right? We're definitely all having something. And so it's
yeah.
so important to like focus on sexual health because believe it or not, you can actually damage yourself if you don't.
Hmm.
Sometimes people don't realize that these sexually transmitted diseases can cause other issues. It's not just what it can do to your genitals, it can cause blindness. Sometimes it can cause infertility. Sometimes you can lose sensation in your area down there because of nerve damage. Some
Mm.
people can get greater infections because they haven't treated STDs. So it's a very important topic. And I feel like, especially when we have multiple partners, more than one, non monogamous, it's even more important to get tested frequently. So I like to see my patients every 3 months. And I always urge them, come back. If you feel like you have something going on in 2, 3 weeks, come back. Bring your partner. We'll treat them. So yeah, that's pretty much what I do.
Well,
Mhm.
thank you for
Interesting.
yourself.
Interesting.
So, what is the topic tonight, Sky?
The topic is raw dogging with multiple partners.
Mhm.
Oh my lord, she
Yeah.
kills me every time.
I
It's,
love the title.
I mean, it's straight up. You know
It
what I'm
And then,
is.
saying?
and then
But
for
And for
that's
those
what
who
it
don't know
is.
in English, it's basically folks who don't use protection
Right. Right.
while having multiple partners,
Right.
which I have an answer for that already. But
Hmm.
there's just going to be people who do that.
Right.
They're just going to be people who do that. And yeah, pretty dangerous
It
out
is.
here, you
Definitely.
know.
Yeah.
So that's what we're discussing, and not only just raw dogging, but just like you know, sex between multiple partners. Like, what is that all about, too? I mean, I think people love that conversation, and they are, you know, what are the conversations? I know even monogamous people are very curious as to how people who have multiple partners navigate
Mhm.
multiple sexual partners. So, I mean, we can jump on whatever direction we go in. So,
Well, I guess it depends on the team of people because I grew up Caribbean. My family is Jamaican and English. And
mhm,
so I grew up in a culture where a lot of times the non-monogamy was very, very quiet.
mhm,
Uncle so and so or auntie so and so, this one got this one pregnant. No one really says anything. This one has multiple partners, but no one says anything. We all keep it hush hush. So now, as I kind of, became an adult and stepped into more of an American culture and like just seeing the freedom of people in America being so different from what I was used to growing up, I've noticed, especially I would say like the folks under 50 are a little bit
mhm,
more open now. So
mhm,
I'm meeting patients that are coming in and they're like, oh, yeah. I'm like, oh, you tested positive for chlamydia. They're like, oh, yeah. I'm like, do you have a partner or partners you like to inform? And they're like, oh, yeah. I already let them know that everyone's already at the clinic. We're all getting tested same day. And I'm like,
mhm.
wow. But I'm noticing with my people, that's not really the topic. A lot of times it's a little bit more hidden, a little bit more discreet. So I think transparency is so important, with these situations.
This is why we do this podcast,
Right.
because we are, I mean, I think, right? I think we're trying to promote polyamory as a viable love style.
Mhm.
Um, and Mitu's perspective, monogamy can still flourish on the planet. My
Right.
perspective is polyamory is the thing for everyone.
Mhm.
And that doesn't mean you have to have multiple partners, in
Right.
my opinion. But thinking polyamorously to me is thinking that there's abundance of love in the world and that you're free. You know what I'm saying? That's kind of the way I view it. But anyway, am I correct, me too?
Yes, you
Yeah.
are.
Okay. So, so in terms of, well, I'm just going to say my standpoint in terms of the raw dog movement. I like my dogs cooked, you know what I'm saying? Because I just think that, like, really and truly, there should just be no opportunity for not wearing a condom,
Right.
you know? However, the other part of the other side of that story is oral. So now it gets a little deeper.
Right.
So that becomes a thing that, like, navigates into a different realm for me, because I was very ignorant for a very long time, thinking that, I mean, I didn't think about it that it wasn't safe, but I just didn't think about it. You know what I'm saying? I was more condom based versus, like, what about oral? I mean, you're still exposing yourself that way. So,
Right.
do you want to, how do you navigate that for folks who,
Oh, for sure. So there is something called dental dams or an oral dam. And I wish I had brought one with me. That would have made a lot of sense. But basically, it's like a condom for your mouth. And you can still like move your tongue around and use that with oral, whether it's with a woman or a man. The thing about that is a lot of people don't like to use oral protection, but what I like to tell people is sometimes we think of STDs and we think of, oh, just the genitals are involved. But I'm here to
Mhm,
surprise you with a little thing that when we're testing for STDs, we're testing at what we call the triple site. So we're testing oral, we're testing urine, and we're also testing rectal. The thing is, you can get your STDs in all three sites. So
mhm,
I always tell people with oral, if you start to feel a little sore throat, um, you've ruled out COVID, you're realizing that it's not exactly a cold because you're not coughing, it very might well be chlamydia or gonorrhea that's in the
mhm.
throat. Sometimes it could even be syphilis that's occurring. So I always tell people try to use the oral dams. It might not be the fun way, but I say, but especially if you don't know the person, it could be a one night stand. You don't want to get caught out there for a one night stand.
All day.
For me,
Yeah,
if it's a one night stand,
I can't hear you. Me too. Maybe it's me. Can you hear her,
it's a
Masonia?
little low, a little
It's
low.
really low.
really, how about now?
It's low, like it's off, like your mic is off.
Huh? Can you hear me now?
I can hear you, but it's like, it's almost as if your mic is turned
Like
off.
it's turned down.
I am all the way high. Let me see. It wasn't like that in the beginning, was
There,
it?
there it is.
Oh,
There it
perfect.
is. Whatever you
Yep.
just did. Whatever you just did.
Okay, so I
Okay, you're on now.
let me. How about now?
It's perfect.
It's
Yeah,
good.
it's good. It's good.
All right. So I don't know. I just clicked on one of the tabs. Um, thank you. So
Mhm.
for me, honestly, I know about oral dim, right?
Mhm.
And I've never used one.
Right.
But for me though, like before engaging with anybody, oh, I was talking about the one night stand thing.
Mhm.
I was thinking like a one night stand, I feel like if I just met you, I feel like there are certain things that are not necessarily gonna happen. Like it's like
Right.
kissing. Like I'm thinking like the one night stand is gonna be just penetration, basically.
Mhm. Mhm.
So to where you just wrap it up, right? Because but I guess a lot of people go out
Mhm.
and kiss strangers. They meet somebody at the club. The
Mhm.
passion is there, the fire is there, the energy's there, and they start kissing. But and that's a question I always ask people: where does sex start for you?
Right.
Because a lot of times people only think of sex as just penis and vagina sex.
Right. Mhm.
Hmm.
They don't think about the kissing
Mhm.
or the oral sex as part of sex. They just think
Right.
penis and vagina. So I tell people, because, you know, in our culture, people are great at shaming people.
Hmm. Yeah.
Mhm.
But I'm like, the second that you kiss somebody, you are exposing yourself to whatever.
That's true.
Mhm.
Person is exposing themselves to whatever, because at that point you're two strangers. You don't know
Mhm.
if or what each other has, and it's not very common. It's a For some reason, for
Mhm.
most people it is a very uncomfortable topic, a very uncomfortable conversation to have. Hey, let's get tested. That's
Right.
why I love the non-monogamy scene or lifestyle, or whatever, the polyamorous lifestyle, because
Mhm.
I've never had any issues talking testing with anybody. If
Right.
we're thinking about we're gonna engage sexually at some point, then it's like, all right, so let's get tested. And I always tell people I am always open, even if I just took a test two
Right.
months ago.
Mhm.
I'm always open to new testing if it's a new partner,
Mhm.
because I feel like you deserve a fresh test and I
Right.
deserve a fresh test. So go get tested, I get tested, and then we come and talk about it and exchange test
Result.
results.
Right.
But we don't necessarily like to talk about getting tested, because a lot of times in the regular culture, those same people that are shaming other people, right,
Mhm.
are the ones that are actually carriers, and they don't even know. As those people,
Mm.
if you've gotten tested in your life, they
Right.
wouldn't be able to tell you because they've never even done it. They've
It's
never even considered it. So many times I hear, people sleeping with each other. They started with the condom, and then 2 months later, it's like, oh, so we're doing it. Oh, so did you guys get tested? No, he's my boyfriend, or
right.
he's my girlfriend. It's like, oh, I see. So just the fact that the person asked you to be their girlfriend, boyfriend, now
Mhm.
all of a sudden, everything is okay. So I always tell people, it starts the second that you decide to kiss that person.
Right.
Mhm. That
That's
is true. That is true.
yeah.
One of the comments says, "Tell them to get tested for two new bacterias called
Mhm.
ureoplasma and mycoplasma. Look into they are sometimes hard to treat." Do you know what that is?
Can you tell us a little bit?
Absolutely. So basically, we would do a test for that with urine. And so when I do a urine test at the clinic, we actually can pull up those tests. They're not necessarily new. Um, it's mycoplasma is something that has existed. It's not necessarily new. Are they hard to treat? Yeah, because most times it hooks onto the urine, I would say like the urethra wall, and that is kind of difficult to treat. So sometimes with people who have those types of situations, I like to refer them to urology as well because there could be something else going on. Some people do get urine infections,
So
and
what are these diseases or these bacteria? What are they
so
doing?
those are just regular urine bacterias. You can get
Mhm.
them in pretty much any way. Some people hold their urine a lot. Some people might have urine incontinence, and it can cause those disorders. It's not necessarily a STD.
Okay.
Yeah. Hmm.
It's not a STD,
Yeah.
period, right?
It's not an
It's
STD.
just bacteria.
It's bacteria.
And it's
Yep. Some
passed. It can
people.
be passed from people to people.
Yeah, pretty much. Some people can wipe from back to front and, not wiping properly. Sometimes you touch the wall, you didn't wash your hands. Like I always tell people because I work in infectious diseases, and I don't know if other nurses would agree with this, but I am in the clinic and I wash my hands before I actually go and use the bathroom. And then I wash my hands again. So
Mhm.
you can really pick up pretty much anything.
Mhm.
Yeah.
Yeah. So, you were talking about dental dam.
Yeah.
So tell us a little bit more about it. Like, how do you think it's as common as using a condom is? And
Mhm.
what are the pros and cons of that?
So I am realizing that it's not as common. Like when I mention dental dams to people, they kind of look at me like, "Girl, really? You on a first date, you gonna pull out a dental dam? Really? To kiss a person?" I'm like, "Okay, you might be right." But I always tell them I'm no longer a player, I'm a coach. Don't worry about what I would
Bam.
do.
I
I'm
love
telling you
that.
what to do
I want
because
to be
I'm
a
trying to
coach.
save you. I'm retired from the game. So,
Hello.
you know what I mean? So I try to tell them, I'm like, granted, okay, you don't want to use it for that purpose, but at least get tested beforehand. Just make
Hmm.
sure before, and I mean, of course, every person probably doesn't want to go on like a doctor's visit before they kiss. I get that.
Right.
So this is where it brings me to the next point. Part of being a person that's in the world, that's dating, that's going to possibly engage in non-monogamy or possibly be monogamous, we have to be sex positive. So part of being sex positive is just being aware that, hey, you know what? I am out here dating. I'm probably going on 4 dates this week. I'm probably going to kiss 4 different people. I need to be aware that, hey, if I get a little tickle in my throat, or I start feeling a little bit under the weather, or if I notice in like a week or so my glands feel a little swollen, I think I might have a fever, that it might not be COVID. And it might not be just a common cold. It might actually be an STD. So part of us being sex positive is adapting the mindset that we're doing something that's going to cause something else. If I'm dating and I'm kissing different people, I'm having sex with different people unprotected, I am now aware that I'm now susceptible to contracting STDs. I am putting myself at that risk. I'm going to be open and honest, get myself tested regularly, let my partners know, hey, I do have sex with other people. I do have sex unprotected. Is this a risk that you're willing to take? If not, it's all good. Some people are willing to go that route, and that's fine, but that's the agreement that you will have with your partners, and that's up to you guys, because guess what, I'll still be there to treat you
Mhm.
regardless.
I
I don't care
think
how
I
many
think
times
it's
you come
better
in.
to just be protected.
I agree.
It's just easier. I have a friend who said, I was like, "Do you get tested?" He was like, "No." I was like, "Why?" He's like, "'Cause I'm never unprotected."
Smart.
I was like,
Okay.
"Oh." I was like, "Oh, okay. Good answer."
Hmm. That
Oh,
is a good
but
answer.
I would not even agree with that answer because nothing is 100% guaranteed.
Hmm.
Like, see,
I mean,
I
it's
don't even want
making
to deal with somebody who's not willing to get tested.
right.
I
I would
don't think it's
still
a
be
not willing. I don't think it's a not willing. I just think
Mhm.
that their risk is going to be less.
Yeah,
Less, but not non-existent.
Yeah,
he would
no. I mean, I
still have
agree
to
with
get
you.
tested with me. Like I hear his his opinion, but I'm like, once again, that's the agreement between him and his partner.
Right.
Mhm.
He's sleeping with somebody. He might not
Right.
be able to sleep with you. He might not be able to sleep with me, but he's sleeping
Right.
with somebody, you know?
So before we move below the belt, right,
Hmm.
I would like to ask, so what are some of the infections that you may have symptoms starting in your mouth, your throat, and like your upper body? I'd
So
like,
I would say most of them, out of the 8 STDs, I would say the primary ones off the top of my head, gonorrhea and syphilis will give you the sores in the mouth. Also,
Delicious.
herpes is another one that will give you sores in the mouth or around the lips with herpes. With gonorrhea and syphilis, you'll more see the sores like inside of the mouth. We call it a gonococcal um, sore. When we see it in the mouth, it's like reddish, it's a little open. With syphilis, you also have the same situation either in the mouth or down below. Now, syphilis will present with rashes. That'll give you rashes along the torso, sometimes along the chest area, along the side of your stomach, along the arms. It runs like in the neural pathways, which is like the nerves that run along the sides of your body. And yeah, yeah, that's pretty
so
much what
how
the syphilis.
transmittable is it, or those
Mhm.
when they're in your mouth?
Highly, absolutely
Wow.
highly
Like
transmittable.
you mean like somebody drinks from a cup and you can transmit that, or just like we're talking like oral sex transmission?
Yeah,
Or
absolutely.
they kiss you.
Yeah, definitely. They
When
kiss you. You can definitely get it. I would
oh
be
my gosh.
mindful.
Like from
Absolutely.
Done.
Yeah,
drinking from somebody's cup or sharing something.
absolutely. And
Okay.
that's why even with children, I tell them be mindful with your kids. They're touching stuff, putting their hands in their mouth. Children end up with herpes. This happens like all the time.
Right.
because there's germs everywhere. You know what I mean?
Mm-hmm.
So it's
That's
really a
one thing.
matter of hygiene.
That's one thing
Mm-hmm.
I really wanted to bring up as well. So
Hmm.
again, we are in a culture of shaming people, right?
Right.
The
That.
Hmm.
stigma. So the stigma for the most known one is herpes, and
Yeah.
we have herpes one, HSV1, and then we have
Hmm.
herpes two, HSV2. So
Hmm.
typically they say HSV1 is around the mouth area,
Right.
correct?
Yep.
So now those people who like to shame people, right? They'll
Right.
have a sore. All of a sudden, it's cold sore,
Right.
not a herpes thing. Why don't you go get tested? Because it's people, it's what they do, the
Right.
stigma. Even if it like that person would never even try to get tested because of the fear of, oh my God, I may have herpes now,
Right. Right.
and they think it's a death sentence. So they're never going to get tested and then can pass it on to other people because they are either ignorant, unwilling on the subject.
Hmm.
So tell us a little bit about the mouth, how dangerous is it, and also what people should know about it.
Right. So when it comes to herpes and the mouth, okay, my cat is fighting me. She's like, I don't want to talk about herpes. I would say the main thing is that we need to observe with a person is the outbreak. The outbreak when a person has open sores is when they're the most contagious.
Mm-hmm.
So in a situation like that, I mean, I'm very, very, like I said, my patients are pretty great. Um, when they are having outbreaks, I get the text message. They're like, listen, I'm having an outbreak. I need a prescription immediately. We get the team, and I'm like, guys, this person's having an outbreak again. Can you, send over something? And what they do is they will wait and basically maintain their stress level, which is very crucial to outbreaks. When you're super stressed, your body reacts. Next thing you know, you're breaking out all over your lips. Sometimes, if you have HSV2, you're breaking out in your genital areas. So they take treatment. Once they take the treatment, it takes a little bit of time. I would say at least up to 2 weeks for the source to start to calm down. And after that, they're least likely to be able to transmit the virus at that point.
Mm.
Yeah. So
Mm.
at that time, we recommend no sex. Some people utilize their sex organs for sex work, and sometimes it's not really
Feasible.
feasible for them to not have
Damn.
sex. So in a situation like that, they have to do what they have to do. They have to use protection. Some, of course, when it's on the mouth, of course, they probably, don't really want to be out there doing anything. They probably cannot. But if it's down there, it's probably easier to hide.
Oof.
Yeah.
So
Okay.
also, when I went to the doctor once, I think I knew this before I went. They don't.
Mhm.
Herpes is not tested normally when you
It
go
really
in. When you
isn't.
go in to ask for STD screening,
Yep.
that herpes is not part of that screening. You actually have to ask
Yes.
for that, just to be
Absolutely.
like folks need to know that that's not like part of the like walk in and get tested. It's not even on the list, I don't think.
Exactly.
No, it's
Yeah.
not. That's
Yep.
one that was going to be my next point because
Hmm.
I actually have a partner that one time when well, in the beginning when we were getting tested, um, I told him specifically, hey, it's not on the regular panel. So if you, because he was going to the doctor, I said, if you go to the doctor and said you want STD testing, they're not going to test you for herpes.
Right.
Yeah.
I would like for you to get tested for it. So you
Right.
have to ask for it.
Right.
And he did ask, but guess what? They still
Mhm.
didn't do it. When he
Right.
Hmm.
got his results, they did not include the test in it.
Hmm.
So this is something that people have to be aware because a lot of times people like to say,
Absolutely.
hey, I got my test results, they're
Right.
negative and stuff like that. And it's just the basic chlamydia, HIV kind of thing.
Right.
So what I like to tell everybody, I kind of remind them, hey, it's not
Mhm.
included. I personally use an online service. I don't really do it at the doctor.
Okay.
And because that whole panel includes like a whole list
Right.
of the stuff that with herpes 1 and 2 included. So that way, you know exactly what you're getting tested for. You get the
Right.
test results and stuff like that, and you can share exactly what you want to share. So yeah, when people keep telling you, "Oh, I got tested and it's negative,"
Mhm.
it's like, "So what did you get tested for? Let's look at it together."
Exactly. That's very important.
Yeah,
I
don't just tell me that it's negative. I want to see
right,
it too. You don't have to
right.
send it to me, but let's meet and
Exactly. That's so important. I
yeah.
So we have
personally
some questions that
oh,
popped up.
okay.
I wanted to read. Kevin
Mhm.
says, when I was younger in the late 80s, there were folks that would use saran wrap instead of having the convenience of a dental dam. What is your opinion on that? Saran wrap.
Wow, that's so funny because there's a movie I'm thinking of right now. One of the Wayans brothers is in it, and he literally uses saran wrap in the movie, and I
Tell
just
me
seeing
it's a
that
thing.
written.
So tell me it's a thing so I can go buy a whole.
I wouldn't, that's funny. I don't know, I wouldn't recommend saran wrap solely because I'd like to assume that it's a little bit more of a breathable
Right.
material. And the dental dam is not as breathable where there's like holes. So I'm pretty sure with saran wrap, certain microbes and, bacteria can get through
Oh,
the
wow.
microscopic holes that we can't see, but they're there. So I don't recommend it. I would definitely just invest in the dental dams. Also, of course, these tools are expensive, right? Condoms and all this fun stuff. But you guys can always go to your local sexual health clinics and or your departments of health in your neighborhoods, and they give away free everything.
Okay,
Including
this is not New York. So
you guys don't have Department of
we do
Health?
not
We
have that
do
type of
have
stuff in our
Department of Health.
neighborhoods.
You guys gotta have
I've never gone
Department
to
of
the
Health.
Department of Health. I just
We
go
have
to
a Department of Health, but it's
whatever.
not
Yeah.
like down the block. You know what I'm saying?
Oh, I get
Like,
what you
because
mean.
it's
I get
like
what you
probably
mean.
the county health
Yeah.
department. You know what I mean?
Right,
Like,
right,
so
right,
it's
right, right.
like we got to drive. But I get what you're saying.
Oh, I get what you
I
mean.
understand that.
Yeah, New York is definitely it's there's like one in every city out here or every town.
Yeah.
So yeah.
I know my health department, but I've never thought about like, oh, they give away free condoms or
Yes,
whatever else.
absolutely. Yep, I speak to the Department of Health because you see the STDs, a couple of them are reportable. Chlamydia, syphilis, HIV is reportable. So I do a lot of, I guess you could say, talks with Department of Health across the states. And they actually do give away free condoms. They give away free, they're supposed to, at least. I can't speak for Georgia,
Okay,
as
yeah.
you mentioned it, but I know New York and at least the tri-state, they do give away free condoms, free contraception. They do treatment, so some people can get on PrEP and PEP to prevent HIV.
Hmm.
Or if let's say you happen to have a one night stand, you're not sure if the person has HIV or not, you can get on medication to help prevent HIV in a situation like that. So they're supposed to offer those things.
So before we move forward, I know we're gonna get to a couple of the questions that are up here, but I wanted to ask you, and then we can come back to the answer. Why
Mhm.
are they reportable? Okay, so that's
Right,
the question to keep in mind. But
right.
let's get to these
No
comments.
problem. I'm trying to read the
I'm
questions.
curious regarding raw dogging and procreation. How might I deal with a partner who raw dogs a
Uh,
lot
and
and doesn't believe in abortion?
well, I mean,
It's
to
really
me,
up to
it's
them.
it's
From
it's about the
El
agreement
Rico.
you have. It's about the agreement you have with that person, right? Because if
Right,
it's somebody who doesn't believe in abortion, you don't want kids, right?
right,
And they want to raw dog, right? I would say that this is not somebody you want to deal with if you want all of the things that they don't want.
right.
I mean, the answer is plain and simple. I would think I would not want to deal with somebody like that,
Mhm.
unfortunately.
I mean, basically it's like, do you want children? No.
Right,
Do you want children? Well, maybe if it happens, okay, well, I'm not the person for you
Right.
because
Yeah,
There will
you have
be
to know what
no
you want.
there will be no babies coming out of this one
Mhm.
Right.
ever again.
Right.
So it's definitely like what is it? Non-compatible? That's like a non-compatible thing.
Right.
In my opinion, that's what I'm thinking. Or just get your trip game up strong, you know what I'm saying? Like going down the stairs, just put the foot out, you know what I mean?
Right. You're so funny. You're so funny.
I told that to my daughter. I was like, there ain't no children coming out of here. I'm telling you right now. I will trip
Right.
y'all and make it look like a whole accident.
That's so
Sorry.
funny. So funny.
I
Ah.
don't care.
I'm done.
Bye.
All right, next one. Testing establishes trust and integrity and equal playing field.
Right.
Yes, I would agree with that. Oh, that was clarifying. Um,
Mhm.
who's that? Abdullah. What
I'll
about
do.
HPV?
Yeah.
Yeah, what about HPV? Because that's not something that actually we get tested for. I never really see it on the panel.
Right. It's not on the panel. So there are a few tests that you do have to request. And it's funny because I learned this about a year ago because I assumed that, it depends on your system that you're using in the clinic. You can choose testing, period, STD testing, and it will populate the test. So sometimes when you work in the lab, you don't really think to look to see what's in it, but I'm a very nosy person. That's why I'm in nursing.
Mhm.
So when my clients come in, I basically sit down and ask them a bunch of questions. I ask them if they've had a history of certain STDs. I ask them specifically, especially depending on their age, especially when they're in their 20s. I'm like, okay, under 26, they can get the HPV vaccine. Have they ever had it before? There's just certain, it's like a different line of questioning per person. So what I like to do is ask all the questions to see, would they benefit from certain testing? Is there something that maybe they don't need? Because I may have a patient come in and I'm ready to do all these STD panels and they swear that they have not had sex in 10 years. So it's like, what am I doing all this testing for? If you genuinely say you are not sexually active, now if from my own curiosity, I might pull the test, honestly, just to see like, are they sure? But if I pulled it a few times and really genuinely they haven't had anything, I'm gonna leave well enough alone. You know what I mean? So with HPV, what I recommend with people in that situation is there is the Gardasil vaccine that people can get. So it comes in a 3 series treatment. You have to get your first dose month 1, then month 2, and then within 6 months, you get the third dose. Um, I recommend it for people. I also do firmly believe for people who do not like to vaccinate, it really does go back to hygiene. Um, HPV is really being transmitted by sometimes
Dirty
people have a
motherfuckers.
right that part. I didn't want to say that, but like truthfully, if you're uncircumcised and you are having sex with multiple people and you are not pulling back your foreskin and cleaning yourself
Men.
properly and getting everything out and being extra clean, then you're going
Dirty
to
dicks.
transmit certain things.
Got
And
it.
yeah, it does happen. You know what I mean?
Disgusting.
Sometimes on women, it'll show up as a positive pap smear.
Mhm.
And that pap smear, they'll think, oh, you have all these, they may call it dysplasia. Dysplasia is basically a difficult looking cell. So basically, what it's saying is your vagina is showing cells that don't look like the cells that are supposed to be in your vagina. And it's because those cells belong to someone else. You know what I mean?
Damn.
So what happens is you now have to get treated. Your partner probably is maybe not going to get treated, and that is what helps to increase the risk for HPV.
Wow. I
I
have
Yeah.
mean,
a
I know
question.
when I go to the gynecologist yearly,
Hmm.
they do the pap
Pap.
smear.
Right, right.
So that is so
Yeah.
uncomfortable, but
Very.
it's something that's necessary.
Miss Masanya,
Hmm.
are you poly?
So that's a good question. I am a poly coach. I am on the sidelines cheering
You're
everyone else on.
you're
I,
you're you're a bystander?
Yeah, pretty much. Yeah, I was for many years, and I retired recently when I married my very monogamous
Wait a
husband.
minute. Wait a minute. Wait a minute. Wait a minute. Retired? You can't
I
retire.
retired.
There's
You
no
know what?
retirement.
You know what I like to say, truthfully? Polly is always in my heart. I have very like special people that are in my little kitchen table. My wife has a very good friend who he is like a partner to us. He looks out for us. He calls and checks up on us. I had a very good friend that was the same way to both me and my wife and the kids. Unfortunately, he passed away. So we have our, I guess you could say, we're not interacting sexually with these people,
Right.
but they are like very much a part of our little, like, if me and her get into an
Okay.
argument, they're the first people we're calling. You know
So
what I
that
mean?
so to me that's still poly. That's still
It
poly
is
because it
absolutely.
still
Yeah.
creates a sense of very inner, not just the inner circle, but the inner circle.
Right. Right.
And
Absolutely.
yeah, that's still poly to me. That's why I'm saying, that's
Right.
why I think everyone can be poly because you don't have to have
It's true.
multiple sexual partners to be poly. You
Right.
know,
Right.
it is under the guise of it, and that is fine for those who want that. But
Right.
really, I think, and maybe I'm just stretching the definition of it, but I really think it is more
No,
so.
no. You
I'm
know
not
what? We share the same sentiments. I do believe, though, with monogamous people, when they hear the P word, it's like, oh, did you just say poly? Oh, no, we can't do that. And I'm like, okay, but we're not having sex with anyone. We've opened up our family. You know what I
right.
mean? Yeah.
Right. I mean,
Hmm.
that's how I look at it. And I just feel like, and I think a very strong part of why monogamy is not a thing to me is
Hmm.
because there's so much toxicity in what is deemed as monogamous. I haven't really seen much of successful monogamy where it isn't toxic. It isn't like, don't look that way, or,
Right.
like I don't see monogamy being lived in a way where either like the woman isn't being oppressed,
Right.
or um you know
Hmm.
oh, don't talk to my man, like you can't have friends of the opposite sex
It's weird.
if you're in a relationship, because
Hmm.
obviously your guy friend is waiting for you to you know give
Right.
sleep with him, or all of these things, and I'm just like,
It's very
yeah,
complex.
yeah.
Yeah, it's very complex.
But
Okay.
I'm glad you answered that. Thank you.
Absolutely, of
Yes.
course.
We have, okay, here in South
Mhm.
Carolina, the doctor gave me the third degree,
Oh wow.
Paul DeRosa. What does
Mhm.
that mean? Give him the third degree. What does that mean?
I'm curious to know if it's what I think it is.
Tell us a little bit more, Paul. We're waiting
Yes,
for you.
please.
We're here.
Yes. How
Mhm.
do young people get educated about all this?
Oh yes, this is a
Um,
huge
I
topic.
I personally, so my 13-year-old, we have started
Mhm.
having sex talk.
Absolutely.
I think it's however open you as the parent are willing
Yes.
to be with your
Hmm.
children. We in my house we're very open,
Right.
sex positive and all that, but you have to give information based on their comprehension,
Right.
understanding, because I can't throw big things at a kid that doesn't even understand the basic of
Right.
certain.
Right.
So far with the 13-year-old, we've had the talk of course, body parts, feeling uncomfortable if somebody touches you. And
Mhm.
what I try to remind them, like anytime you have a little feeling that's just kind of like,
Mhm.
listen to it.
Right.
Don't
Mhm.
ignore it. But we have gone as far as talking about penetrative sex,
Mhm.
condoms. We've looked at condoms, opened it up,
Right.
talked about how you use it and why you use it. Um, I don't think we've gone into oral sex really. So I try to answer the questions as they come, and then when they come, I'll add
Mhm.
something to it. I'll
Right.
dive a little bit deeper depending on the situation.
Mhm.
But we openly talk about sex and what sex is for. It's for pleasure, it's for procreation,
Right.
and there's all kinds of different sex, and it's pretty much about consent and
Right.
consent and consent. So
Mm-hmm.
Point.
Absolutely. Yeah, I think children should be learning from their parents, to be honest. I
but
agree with
you have
that.
to educate yourself as a parent as well. Don't be biased
Mm-hmm.
based on you may believe or prefer certain things,
Right.
but don't hide the information just because
Mhm.
of what you prefer.
I mean, the problem with that though is parents who don't have the correct information, and they're giving their children this ronky, ridiculous information about sex, sexuality, and what have you.
Right.
And then they go, of course these children go out to school, go out to the streets and all that stuff, and they hear a whole different thing. And then they choose. You know what I'm
And
saying?
that's why I say educate yourself as a parent.
Right. And it's like, I think that um I mean, I can't tell a parent how to parent, but in my
Right.
mind, I think giving a broader scope for their child to, like, for example, I know there's some parents that teach that, like, masturbation is bad.
Right.
Right.
And so, um, yeah, so that becomes a a a conflict, I would say, when the friends start talking about it, you know, and then your child has to pick where they're getting their information from. And
Right.
I feel like when I think about my high school days and back in the day, I feel like I was really getting information from my friends. You know what I'm saying? Like,
Mhm.
I first heard about sex from school. Like, that's where I first heard about it. I remember it was like fifth grade, and one of my friends says, "Oh, something about she's a virgin." And I was like, "What's that?"
Right. I mean,
And I remember I never heard of I never knew that what that was. So,
Mhm.
I don't think our generation had much sex talk. I'm not saying everybody, but
That's
most of us,
true.
at least from the Caribbean,
Mhm.
being from Haiti, they
Mhm.
never talk sex. They just tell you, don't get pregnant, don't
Right.
go sleep with boys because you will be a slut.
Right.
I
Pretty
mean,
much.
all the negative stuff,
Mhm.
they never truly talked about sex for us to know what that is and what are the benefits, what are the downside. Like none of that. We didn't.
mhm,
So that's why I'm like, making it a mission to talk to my children about sex, the good, the bad, and the ugly.
mhm, absolutely,
Mhm.
absolutely.
So
Well,
we have one
I
more.
think Paul DeRosa clarified. He said his doctor asked him a bunch of questions about this. Well, it depends, Paul. I mean, I asked a bunch of questions too, but also it just depends on the questions. I'm wondering if maybe they were like, some
Invasive.
providers can be a little bit judgmental, and it breaks my heart when I see especially providers that work in like sexual health. It's almost like they're judging you because
Yeah,
it's very
yeah.
common. I'll walk you guys through like the common questions. So it's not uncommon for providers to ask, who do you have sex with? Are you having sex with just men? Are you having sex with women or both? The reason for that is there are higher rates with males who sleep with males contracting syphilis and how that affects women. So we try to understand, okay, if you're sleeping with women, and men, how can we gauge your care to help you
Better
not
protect
transmit
yourself
it
than
as
others.
much to, both? But if you're only sleeping with men, then we can kind of gauge your care a different way. So like if they're kind of asking you these questions and it's almost like a
Judgment.
you're not sleeping with men and women, are you? You know what I mean? They shouldn't be
But
asking like that. It should really just
I,
be a general like yes or no, just to figure out how to gauge your care.
a friend of mine was telling me his experience. Me too, you know him. And was saying that he went to get tested, And the doctor was like, why? What's changed? And he says, oh, I'm no longer with my wife. I'm dating. And the doctor was like, oh.
Right, right.
And and so it was that kind of question, like, well, why would you need to be tested if it's just if you're
Yeah,
just monogamous with, you know? But he's
Right.
like, oh no, he's like, I'm out the gate now. So
right,
And
right.
that's
yeah.
something I feel like they always discourage monogamous people to get
Mhm.
tested. Like they
Mhm.
look
Yeah, they
at
do.
it wrong. Like you
Yeah.
should not be getting tested. I'm like,
Absolutely. Because even patients who I know that will go to like their primary care doctor just for regular checkups, if that patient says like, oh, I just want like a full STD panel, and the doctor pulls for HIV and it comes back positive, they notice that their doctor is just almost like not even wanting to see them. They don't even want to touch them. It's so bad
Wow.
that even if they go for a dental appointment and there's like anything that mentions HIV, the dentist almost doesn't want to see them. So it's like extremely stigmatized with certain things between STDs and HIV. Like some providers treat it like all one thing and they're just like, oh, you have something. And I'm like, a person can have anything. If you're eating fried chicken every single day, you very well could end up with high cholesterol. So if you're having sex, you're gonna possibly end up with something. So, why are we stigmatizing it?
Yeah.
But yeah, this is the unfortunate part. But what I like to recommend for people is to this is where we got to do our footwork and find providers that are not treating us inappropriately because
right,
they know that we have this or we have that. Now they're mistreating you. No, go elsewhere. Call
right.
your insurance company, report that provider, let them know you didn't feel comfortable when you stated you had certain diagnoses, and keep it moving. There's always other providers. Yep.
Hmm.
Mhm. Ancient indigenous
Are
techniques.
you aware of any ancient or indigenous techniques used by older tribes regarding protection from raw dogging? For example, certain plant materials, or I heard about animal skins like goat, sheep skin,
Mhm.
etc. Hmm,
Let me take a
never
look.
heard of it.
Very interesting.
Yeah.
I mean,
Hmm.
the only one I'm familiar with is the condom skin. I think isn't that
Right,
that's
right.
made out of but is that only for pregnancy, I think?
So I recall like people using like different because if they're allergic to latex, they'll use like animal material condoms. But when I'm reading the question, it almost makes me think of certain things that people use, not just for raw dogging,
Herbs. Yeah,
but
like
herbs
herbs.
and like for example, in Jamaica, they make something called manish water, which is goat head soup, and they use it for fertility to increase fertility.
Hmm.
So I'm thinking of things like that when this person asked this question. I'm thinking like Irish moss, which is another herb that is pretty much sea moss, and they
Hmm.
flavor it with like condensed milk and all types of fancy Guinness and you name it. They throw it in there, cinnamon,
Hmm.
everything, and that's used for fertility as
Virility.
well. Yeah,
Virility.
so virility,
Um,
exactly.
the only thing I'm thinking of, and it's kind of like what you were on the road to, nothing to really prevent
Right.
disease, but more so, I know all the herbs to prevent pregnancy.
I was just gonna say wild
Yeah,
carrot. Yep.
yeah, cause
Oh yeah, that used to be
don't
my
don't
fave.
start nothing, won't be nothing. You know
A
what I'm
fact.
saying?
Yep. Yep.
But
My
other than that, no.
right.
And when I think of like tribal and indigenous, I don't think of
Mhm.
diseases for some reason. Like I just and I know there were like once the Europeans came, maybe that's like the
Absolutely.
history of story I got, but I don't
Hmm.
feel like tribal indigenous people really had sexually transmitted. That could be my ignorance,
Right.
but in
Right.
my
I
mind, I
understand.
never heard that before.
I feel
So,
like they were able to heal things as they saw it. You know what I mean? There was always an herb right there to fix it. I mean, I grew up, my great grandmother was a roots woman, always
mhm.
going to the yard, picking out things and
Bush
mixing them
hunting.
with
Of
tincture.
course,
Exactly.
how we
You
grew
know
up.
what I
Mhm.
mean? And you were healed.
It's how we
Absolutely.
grew up. So.
Absolutely.
Okay. So now, before we jump into the next couple of ones, I wanted to ask you
Mhm.
what are the reportable ones and why are
Mhm.
they reportable?
So the reason why they're reportable is truly because they are, how could I put it? they affect large groups of people, and it happens fast. And when these diseases start to spread, long term, they can cause population decrease because they affect fertility. Syphilis, in particular, can cause movement disorders. I have had people come into me for treatment for syphilis, 22 years old. They're walking in, dragging their foot. They've had pain. They can't walk. They need a cane now. And it's syphilis because they've had it for some time and didn't know. It can cause blindness. So it's a type of disorder that can cause greater issues. And imagine having a whole population with these greater issues because they're not getting tested. We need to know that if you have contracted syphilis, we're tracking to see if it's been treated. We're tracking to see, oh, okay, the doctor's aware of it. Did they reach out to the person? And if we cannot get you in the office to treat you, the Department of Health is going to come and knock on your door. They will.
What are
Ooh.
the early signs?
So early signs, it depends on really it depends on the person. With syphilis, some people will feel like cold symptoms, a little bit of flu symptoms. I would say sore throat in some cases, and then it just progressively gets worse. A lot of times you'll see a little rash. Sometimes it gets confused for allergies. I have a lot of patients come in. They're like, "Oh, nurse, look, I have this rash," and I'm like, "Well, are you using a new detergent?" They're like, "No." In my head, I'm like, "Oh, it's syphilis," because it's just these little things that we don't think anything of. So we always run a full panel for a patient like that. If I see you coming with a rash or a little sore by the groin area or just a random sore that you've never had before, I'm like, okay, let's just check for syphilis. But I usually check for everything because I'm nosy. I need to make sure everything is clear.
Is it curable or treatable?
So there's a few that's treatable or curable rather, and then there's a handful that are not. So something like HPV, HSV 1 and 2. I'm trying to think off the top of my head. I know I have the list in my phone.
Mhm.
HPV, HSV 1 and 2. There's two more. I see them, but I can't pull them out yet. But those are the ones that are not
HIV.
curable.
Chlamydia,
HIV, duh. How could I forget HIV?
HIV,
Chlamydia is curable. Gonorrhea is curable. And I'm trying to think. I
Syphilis.
have them.
chlamydia.
Syphilis is curable. So with syphilis, it's kind of it can stay in your system for some years. I could break down how syphilis goes. Syphilis is pretty much they test it on two levels. They test it on what they call qualitative, which is where it gives you a number, and then there's quantitative where it tells you if it's non-reactive or reactive. So if I give a patient treatment for syphilis, I'm going to check them every 90 days to make sure that the qualitative number, which is usually like 1 to 1, 1 to 8, 1 to 4, goes down. Let's just say, for example, I test a patient today and their number comes back as 1 to 8. I know that that's a patient that needs treatment. It's going to show up as reactive. I know for a fact this person has syphilis. I'm going to give them treatment, which is usually in the form of penicillin or doxycycline, which is pills, and the penicillin is usually in the form of an injection. And once I'm done with that, I'm going to test that person in 90 days to see if that 1 to 8 went down. If that 1 to 8 goes up to like 1 to 16, I know that that patient has gotten a reinfection and we need to do a little bit more aggressive treatment. But if it goes down to like a 1 to 2 or 1 to 1, that lets me know that the treatment is successful. So let's say 90 days after that again, I test them and it goes to non-reactive and there's no number showing up for their qualitative state, that lets me know that the treatment was completely successful. But some cases, a person will have a 1 to 1 for years. So it's still showing up that there's just a sign that syphilis was present. A person like that can transmit syphilis up to 2 years.
Mm,
Absolutely.
that's interesting.
Yeah. So it's a lot. It's a lot. But I love what I do, and like I always tell people, it doesn't matter what they come in with. I'm gonna find a way to get them some type of treatment with no judgment, and I think that's the most important thing, so that people feel
Absolutely.
comfortable. to just come
Absolutely.
and get looked at, even if it's once a week. I have some frequent flyers that come in once a week, and they're just like, and I'm like, well, what happened now? They're like, sex party gone wrong. I'm like, okay,
Uh,
come on in,
At
let me
least
give you
they're
some treatment.
responsible in that sense, trying to find out,
Yeah,
if they
absolutely,
are being safe.
absolutely.
Um, Abdullah said polysexual and polyamorous are not synonymous. Yeah, I would agree.
Yeah,
Just like bisexual, bi romantic, all of that,
hmm
Um,
right,
uh,
However,
mhm.
polyamorous can be polysexual.
right.
Yes.
Hmm.
As he said, but the possibility exists, doesn't it? What possibility, Ezzy? So I think we addressed Paul already.
Right.
There's no protection for oral sex, is there? We did talk about that in the beginning.
We
Oral
did.
stimulation.
You skipped Paul's comment about if you're married, they don't understand why you want a STD.
Oh
Yes,
yeah, that's true.
right.
Yeah,
Because
because
it's assumed that everybody's gonna
right,
be what you call it,
monogamous
Monogamous.
or not. Yeah,
monogamously faithful.
right.
But
Yeah.
like you said, Matanya, there are certain things that you can just touch. You can catch by touching certain
Right.
places.
Absolutely.
So it's not necessarily because somebody cheated. They may have caught like a virus somewhere,
Right.
right? So you gotta,
Hmm.
gotta get tested regardless of monogamy.
Absolutely. Yeah. I mean, it's
Not
just the
100% guaranteed.
it's the safest thing. Unfortunately, there is, a common misconception that if you're married, you're safe. I take care of married couples every day that have HIV. They come in for their appointments together. One person may have stepped out of the relationship, and they might have had a monogamous contract between them, but sometimes things happen. And that's where that transparency and honesty comes in. Have the conversation. Hey, yes, I did go out and do X, Y, and Z. Some people are afraid for their relationship to fall apart. And I always tell them maybe that's just not the person you should be with if you want to, you know, date openly.
Right.
Or they might surprise you and say,
Um,
hey, I'm willing.
I read an article about a couple in, I want to say, South Africa, that was they were talking about the statistics of HIV over there, and the husband was a medical doctor and the wife was a nurse,
Mhm.
and they didn't work in the same vicinity. Like, she was working in like a hospital somewhere, and I think he might have had a private practice, or however it went. They weren't like at the same place. Anyway, long story short, she asked him for, like, to start using, she brought condoms home, and she asked him to use condoms with her. And he was like, what's going on here? And I guess she had suspected that he was sleeping with other people.
Mhm.
And lo and behold, they both contracted AIDS.
Wow.
And but it was a stigma for her to ask her husband to start using protection with me because, she just wanted to feel safer.
Right.
And he refused. He was like, absolutely not.
Mhm.
Yeah.
That's really
So,
sad. And that still is happening
and
to
then the
this
fact that
day.
there are doctors in the medical field and all that stuff is
And
crazy.
that just says a
Oh,
lot. It really does.
Right.
yeah.
Right.
Because
Farrakhan.
unfortunately, a lot.
Um, we did talk about dental dam. That's what it
Right.
is.
Dental dams. Yep.
You have to get tested twice, the initial, then 9 weeks afterwards. Hmm. Abdullah, do women feel it's safer to have sex with other women without testing and contributes to more lesbian relationships?
That's a good question. Hmm. I can't speak for other women. I do think prior to my life as an infectious disease specialty person, I did have that mindset. Absolutely.
Hmm.
Yep, I did. I did. Now, however, my life has changed. And I'm
Mhm.
like testing for everyone. But yeah, that was kind of, and I truly think, not to be graphic, but I do feel like, with women, you can basically scratch and sniff. You can tell if someone it's like, you know what I mean? Like you dig a little deep, you can tell if someone has any type of funny odor. You can look to see what the fluids look like. If they're green or yellow, you know they're
Gross.
vulnerable. The thing
In the
is,
middle of all that, you're gonna do it?
no, come
I
on. If
need a
you see
little, I need
that,
to
you're definitely
get a
not doing
little
it.
Q-tip here.
Right.
Hold
It
on
needs
a
to be a little
second. I
assessment.
know we're in the middle of it, but give me one
Let
second
me
to
just
kind
swab
of.
you out here real
Right,
quick and find out
literally.
if you have any. Let me put it in my
Knowing
little
me, I always have a swab in my pocket, so I literally can just like real quick,
yikes.
you know. But sometimes
So
people just be
guys, bring your
uncomfortable.
Q-tips.
Bring your Q-tips.
You know,
I literally have a
that is
swab right in front
funny.
of me.
But you know what? That's actually a really good question though, because
Yeah.
I wonder, do lesbians
Hmm.
get tested as often as heterosexual people or even gay men? Like,
Right.
I always wonder because I feel like maybe a lot of women think, oh, there's no penetration there, right?
Yeah.
So, but can't you transmit something just
Absolutely. I
okay?
feel like it really depends on the relationship. Like my wife and I got tested when, like, I would say like 2 months after we started dating, which of course we were late to the party, but we did. And we honestly never got tested again, but we do our GYN appointments together. And so my GYN let me know, she's like, because there's no penetration, really, I can go 5 years and not get a pap smear. She's like, but if you need to come in, you feel like something's wrong, then come in. I'm like, okay, cool. So, yeah.
That's
Hmm.
good to know.
Yeah.
Um, I think I had a couple other questions. Okay, so for first, I want to talk about the HPV vaccine because they tried to push it for teens.
Right.
What is your take on that? Because as a parent, I have a teenager,
Right.
and now, so I personally, I just do the vaccines that I was given pretty much. I don't try
Yeah.
to do the newer stuff like, COVID
Right.
and all that stuff. But
Yeah.
now I live in America and it's a different world, right? It's a different
Yeah.
world than what I grew up in. And I want to protect my children as much as possible, but I'm
Mhm.
also like very skeptical about the agenda of some
Mm.
pharmaceutical people. When it
Absolutely.
comes to the vaccine for HPV for teens, I'm still like when I go to his doctor, the
Mhm.
pediatrician. I know we're going soon again, and she's
Right.
gonna bring up the topic again, and I'm
Right.
just like, and I don't want to be that ignorant parent who's like, I'm not doing this. I want to know the pros and cons, and
Mhm.
because I want to do what's best for them.
Absolutely. I respect that. I'll tell you the truth. I have daughters, and I haven't given them the vaccine. Something just doesn't, and I'm very spiritual as well, so I'm not even going to bring science into this. I'm going to bring spiritual into it. I just feel like I'd like to give a vaccine that could possibly alter certain things to a body that is more developed rather than one that is developing.
Yeah.
So I'm thinking like if when they're 18, 19, 20, if they want the vaccine, they should go for it. A lot of the patients that I've been giving the vaccine to are like 24, 25. I just feel a little bit more secure giving it to people that are a little bit more developed.
Yes,
And I can't put my finger on why I get that vibe, but I just go with it. You know what
right.
I mean? So I mean, I can't say that you're wrong. I also feel like for parents, do what you feel is best for your children. I just have not I haven't been moved in my spirit
Yeah,
to give
that
these
part.
girls that vaccine. I'm just not really feeling it.
Mhm.
Yeah,
Okay.
My children have never been vaccinated with anything.
that's
Oh,
amazing.
So
That's
that's going to be a
amazing.
no.
Right.
However, my one of my daughters, she went and got vaccinated because she went to work in a hospital.
Oh yeah, that's hard.
And is at that point, I'm
Mhm.
like, do you?
Right.
You know, I know what I felt as a mother
Yeah.
raising children. I wasn't into it. So
Right.
if you want to go get all the vaccines from childhood up till
Right.
now, all at one time,
So,
Ruby beans, go for it. But yeah,
yeah.
no, the vaccine thing, I'm not a fan of it. I mean, I get the
Right.
concept of it, and I know that, there's a whole group of people who hate me for
I
being
get
an anti-vaxxer,
right. Right.
but I don't care.
No,
I
I get
felt
it. I
I felt
respect
like it was
it.
right, and yeah.
Because like I personally like I gotta I'll step out of my medical mindset. I personally like Masanya, the girl from Brooklyn, hated getting the COVID vaccine. It stopped my period for like 3 months.
Mhm.
It just and like you said, because of work, I kind of like had
We
to
had
get
to.
it.
Mhm.
It was very, very difficult. It took a lot of prayer, a lot of like, oh my God, what am I going to do? But I really had to talk to God on that one. I was like,
Mhm.
God, listen, you get me through this.
I think a lot of people. I think most people got it when we talk about COVID, got it because
Mhm.
of work.
Oh,
Most
yeah.
people I know are like, I'm not into it,
Right.
but I also am not going to be hungry and on the street.
Right.
So,
Exactly.
um, and I understand that making that kind of decision. Fortunately, I didn't have to make that decision at all because
That's good.
my job was like, you could do it if you want to,
That's good.
but yeah, it would have been hard. It would have been hard for me.
Oh, absolutely. Yeah. It
So,
wasn't, it wasn't easy.
I know time is flying by, but I had probably one more question. You
Okay.
mentioned prep and pep.
Yeah.
What is the difference, and what are they for? Like,
Mhm.
tell the people a little bit about what they are for, because many people are not aware of.
There definitely aren't. Yeah. So PEP, pardon me, PEP is mainly post-exposure prophylaxis. It's
okay.
PEP, and what that is for is within 72 hours after you have a sexual encounter. This sexual encounter could be anything. You could have had a one night stand. Let's say, unfortunately, you were the victim of an assault, possibly rape. You can go to your local hospital. I prefer people go to a sexual health clinic or a Department of Health because sometimes the hospitals, they'll give you the treatment, but I don't like the way that they're prescribing it. They're just not prescribing it right. So it's best for you to find like an HIV/AIDS clinic or a sexual health clinic or a Department of Health that will give you the appropriate regimen for PEP. What PEP is 30 days of an antiretroviral, and that helps to decrease your chances greatly of getting HIV. Now, after you complete your PEP, you can then transfer over to PrEP. And with PrEP, you're basically taking an antiretroviral for as long as you need, as long as you're dating, as long as you're having multiple partners, etc., etc. And what PrEP does is helps to reduce your risk greatly of getting HIV and AIDS. It does not, however, protect you from contracting STDs. So that
Okay.
is something that people have to be mindful of.
And is
I,
that covered by insurance?
it is supposed to be covered by insurance. Now, the different types of PrEP versus PEP is what is the difference in insurances. So it's really individually based, but it is supposed to be covered. And from what I understand, the Department of Health, once again, they do give it for free. And companies like my company, they will provide it. They say that they do it without charge, but they do expect you to have insurance, and they will find ways to get your insurance to cover certain things. If not, they have programs in each state. So for New York, it's called ADAP, and that helps you people who have PrEP or need HIV drugs. We're able to sign them up for a special type of insurance to get those specific drugs.
Um, are there any known
Mhm.
side effects of prep?
Absolutely. Some are odd. Sometimes people will have insomnia. Some people get bad dreams. And like I tell people, it's just an introduction to the drugs. Sometimes you'll feel nauseous. Once again, this is an antiretroviral. It's fighting against a virus, trying to stop that virus from trying to replicate or create itself in your body. So, of course, you're going to have a little bit of nausea, vomiting, diarrhea, sometimes a headache, stomach discomfort. Some people get the insomnia, like I said. Some people get very weird dreams. But for the most part, I always tell people, you want HIV or would you like to prevent HIV and just have a little bit of discomfort that we can manage with something, some other medication, or maybe a little bit of ginger ale, you know what I mean,
Mhm.
to help settle your stomach. I always recommend people when they first start on these medications to try taking them at night because I figure if you take it at night, at least you're sleeping. You
Mhm.
probably won't have as much upset. You know what I mean? So I
Mhm.
tell them to try it with a plate, at least a decent amount of food. Don't have it on an empty stomach and just see how it goes. In some cases, we do change people's medication regimen because maybe sometimes that medication just isn't the medication for them. So there
Mhm.
are options, and thankfully, there's a lot of options for HIV and for PrEP.
Mhm.
Quick scenario.
Mm-hmm.
Um, so you have a patient that is
Mm-hmm.
HIV positive, and then you have another patient that's HIV negative, but they are partners, they are together.
Mm-hmm.
So then you recommend that that person without it get on PrEP.
Absolutely.
And so does that mean now in that instance that the person can go raw dog with the HIV person, the HIV infected person, if they are on PrEP?
So not instantly. What I recommend in situations like that is I like to I just learned this in the group and I thought it was so cute. U equals U. So if the HIV positive person is undetectable, they're technically considered untransmittable. So they cannot transmit HIV to a person. Now, if their partner who is HIV negative is on PrEP and they've been on this PrEP regimen for more than 30 days and their partner is undetectable, then they actually can feel free to go ahead and raw dog if they'd like.
You
Absolutely.
you answered the next question that I had was
Hmm.
basically the undetectable, because a lot of people I hear a lot of people bring up that term that I am
Right.
undetectable kind of thing, and I
Mhm.
always wondered what it means exactly. So
Right. So undetectable is related to what is called a viral load. So HIV, it affects your immune system. The immune system has a bunch of cells, and one of the cells is your RNA cell, which is your viral load. The goal is to get your viral load to under 20. That's the qualitative number.
okay,
Once you're under 20, you're considered undetectable. So with our HIV patients, when we have them on pill regimens, we're checking that number every 90 days, faithfully. My patients, I see them literally every 90 days. And I'm like, oh, it's been a while. And then boom, they show up. The patients I have are very diligent when it comes to their regimen, especially when they're in a relationship with someone that's HIV negative. And I also provide the treatment to their HIV negative partners for PrEP. Yep. So
that is
now,
interesting. I mean, we've come a long
yeah,
way from the
we have where previous to this it was always pills, but now we have the injectable treatment, which has made basically having HIV and also keeping PrEP regimens going even more better than before. So now, I guess people are kind of like more accustomed to HIV having this notion of, oh, 20 pills a day. And if you
right.
miss a pill, you're dead. It's not like that anymore. That 20 pills went down to 10. The 10 went down to three. The three is now down to one. And now we also have injections that we give every 2 months where you don't even have to take pills anymore for HIV. And for PrEP, it's every 2 months as well.
I am
It's
so
also free.
excited to hear that, because
Absolutely.
there's so much. I mean, of course, the stigma
Yeah.
around HIV.
Hmm.
People don't even want to hug people who have HIV,
Yeah.
Mhm.
or
Yeah.
don't want to be friends with them, because apparently,
Mhm.
it's like a dead man walking kind of thing. That's what they think. And I
That's the
understand at
mindset.
some point
Yep.
that's how it was, but it is
Mhm.
no longer the case. And I am so happy for
Right.
the advancement of medicine in that sense because, you know, I don't feel like, because when somebody has cancer,
Right.
you know, you don't treat them like, oh, you can't touch me. I don't want to talk to you because you're dirty, you know?
Mhm.
So I always feel like it's hard to stomach when people get treated badly because they
So
get a
true.
sexually infectious disease.
Yeah.
Absolutely. Yeah,
So,
it's heartbreaking to see.
We
yeah.
got two more comments.
Okay.
Abdullah says, once poly people reach a point of what works, ideally, won't that preclude the need for testing? Or does an insatiable appetite for sex become problematic?
What do you mean, like, reach your point of what works? Like, what does
I
that
think
mean?
this is what I think he's saying. I think he's saying the difference between an open relationship and a closed group.
Right.
So what this is what he could say yay or nay if that's the case. But once poly people reach a point of what works, meaning like you got your tribe,
Okay.
you know, if it's 1, 2, 3, 5, 10, whatever the group of people is,
Mhm.
and they're solid,
They're closed.
they're closed, they're
Mhm.
not seeing other people,
Mhm.
will won't that preclude the need for testing?
I feel like polyamory is always changing.
Right.
How do you know that
Hmm.
it's closed? It may
Right,
never be closed.
right.
That 10 could be 20 in 2 years.
Yeah.
You know what I
I mean, it's
mean?
probably easier when you have like three people or four
Right.
people in one
Agree.
household.
Right.
Then you guys are pretty much a solid unit.
Hmm.
You know what I mean? It's when you have partners that, you know, come and go and no one
Right.
lives together that it's really hard to dictate how people are going to carry it.
Right.
I don't feel, even if you live together, how do you think husbands and wives cheat in monogamous relationships?
Well, I'm saying, I agree with that what you're saying. I agree with that. But I'm also saying that, you know, if you make some agreements, you know, I mean, I don't know. I don't know. I'm not saying, I don't know if I would think that, okay, now we got to get 3 months have gone by
Right.
and we have made an agreement to only be with each other if it's
Right.
2, 3, 4, 10. We
Right.
have made an agreement and someone says, oh, it's time to get testing. I mean, I think it could work. I think testing is important, you know, but
Right.
Yeah.
does it need to be every 3 months? You know, maybe it's every
I think
6 months,
it
maybe it's once a year. I
hard.
don't know.
Yeah.
Yeah, I think it never really ends with testing. That's what I feel.
I mean, I feel like, you know, most of us have to get better. I try to keep a 3 month schedule, but sometimes it's four, sometimes it's five. But it's always like in the back of my head, okay, we need to do this. And personally, when I'm doing it, I let my partners know, hey, I'm doing this, you know, I think it's fun. And typically everybody kind of gets tested around the same time. So
Right.
yeah.
Um, Karakaman says polyamorous relationships are high risk relationships. How do you know that everyone will follow the code and ethics of the polyamorous relationship?
You don't.
You don't.
Agreements.
It's
Agreements.
high
How
risk.
how do you know that anyone will follow the code of a monogamous relationship? I mean,
Exactly.
divorce in monogamy is more than 50%. So obviously there is no code of ethics or code and ethics of any type of relationship because people fall off every single day.
Every
Right.
day.
So,
Yep.
It's your responsibility, I feel like, to
Yep.
make
right.
your health.
Control you.
Yeah, you
Right.
can put it on somebody else. You
Exactly.
do your part, and hopefully that other person is doing their part. And
Yep.
together we are doing what we're supposed to be doing. But you can't put it solely on that person because people get weak all the time. They step out of their agreement. Sometimes
Mm.
it's planned, sometimes it's unplanned. But regardless, they break agreements all the times. Or if you don't even leave room for agreement renegotiation, right? They may feel like, well, if I bring this up, they're not going to agree. So I'm just going to go ahead and do this. That's why agreements are made to be changed as well. So
I've heard of a few reasons why condoms aren't liked. Not just the regular, I don't like how it feels, but one guy said he doesn't want to use condoms because he doesn't want his wife to know that he's doing anything. So, not buying them is, and I'm just like,
and that's how things get spread. I remember
yeah, that.
before my second baby, right? So as a married couple, I wanted my tubes to be tied, but my doctor was like, no, you're too young, whatever. What if you want another kid? Whatever. So I would have to go to Walmart and buy my condoms. So here I am with a wedding ring, checking out this younger kid that was checking me out. He must have been, I don't know, 16, 17, late teens, whatever. He looked at me, looked at my finger. He looked at me again and looked at the box of condoms. I see what he's doing. I'm just standing there.
Right.
Like, then he finally asked, he's like, are you married? I said, yes. And he looked at the condom and that's all he said.
Wow.
I didn't explain myself. So
That's judgment. That's
explain
judgment.
Judgment, exactly.
because I wasn't ready to get pregnant again.
Exactly.
And I wasn't gonna go, they weren't gonna tie my tubes. And I wasn't gonna risk it. So yes, what are my options? Condom. But people will always again, it's another stigma, You must be cheating. That's why you get in condoms. And that's why a lot of people, that's how things get spread. So yeah.
And Karakaman says, Abdullah, everyone has to be honest and ethical. If someone goes outside of what's working, will they disclose their actions? Maybe, maybe not.
Right.
Maybe
Requires
you're hoping, and
tons
that's
of
why we
trust.
say it should be on you.
Yeah.
It should be on you, not on your partner. You may trust your partner, but at the end of the day, I am only responsible for me. I can only testify to what I do, not what the other person do. It would be nice that I trust you and you do what we agree.
Absolutely.
Yeah.
Absolutely. It does require a lot of trust.
Yes.
A
Yeah.
lot of trust. A lot of
Yes.
trust. Yeah. Absolutely.
And then Abdullah says, I truly appreciate both of you, your guests for this podcast and the topics. They are necessary conversations in a judgment-free zone. Stay up.
Absolutely.
Yeah.
I'm so grateful for the space. Yeah.
That was a teachable moment. Thank you. Yes, it definitely was. It definitely was.
Yeah.
Well, wow, it's about to be 10:30.
Yes.
So it's time to say goodbye.
It's time to say.
I just want to thank you both for welcoming me on your podcast. It's I really do have a passion for this work, and people in the Jamaica Queens area, you'll know how to find me.
So
Yeah.
I'm from that area. My
Are
grandmother
you?
is from Jamaica Queens. Yeah, my mom went to Jamaica High School. Yeah.
Wow.
Yep.
So listen, I'm out there. I'm out there healing Queens.
Yes.
Yeah.
That's awesome.
I feel like this was only part one because I don't think,
Absolutely.
there's always more to talk about. I am very passionate about sex in general, sexuality, and then, of course, sexual wellness.
Safe sex. Mm-hmm.
We don't talk about it enough. So, I am so grateful that so I met Masanya in a group, in a poly group that we're in, and then she had posted something about being an advocate for HIV because it was the day before HIV Day. And so I was like, oh, can I send you a message?
I'm so glad you found me.
Yeah, so she said yes, and then we kind of connected, and I was like, you would be perfect if you could come on our podcast because I've been looking for a while for somebody to come because on that subject we wanted an expert to kind of come and represent with facts and things like that. So thank you for taking the time
Of
to
course.
educate our audience, because we're here to talk about polyamory and stuff, and Sky is here to convert the whole nation.
I'm with it.
We are also
I love
here
it.
to make sure that you guys have the information that you need when it comes to your sexual health, whether monogamous or non-monogamous, because it's important no matter who you are and how you love. So thank you for coming to the Poly Pimps.
Of
Remember
course.
to
I'm
follow
humbled.
us, subscribe. Yes. So we definitely will be back, hopefully, with Masanya one more time. Maybe not the next one. So our next podcast will be December the 20th, right before the holidays. Um,
Cool.
yeah. So
Should be
hopefully,
a it should be a delicious one.
yes, that's gonna be, yeah. We're gonna post it really soon so you guys have time to get your thoughts together and also spread it amongst your friends, because we are the Poly Pimps.
In the
I
building.
love it. Have a
Thank you
good
guys for
night.
chatting in too.
Yes.
Absolutely. Thanks, everyone.
Alrighty.
All
Have a
Guys,
good
right.
have a
one.
good night.
Peace.
Bye.